As we saw in this week's episode of Context, we took a deep dive into the issue of medical assistance in dying. Since recording that show, there has been some developments. To fill us in on the proposed changes to Canada's legislation around medical assistance in dying, I'm joined by Julia Beazley, Director of Public Policy at the Evangelical Fellowship of Canada. Thanks for joining me today, Julia.
Thanks, Maggie. It's good to be here.
So on Monday, the Justice Minister M.A.I.D reintroduced proposed changes to Canada's medical assistance in dying legislation. What does this mean?
So in February 2020, the minister had tabled legislation to amend the current laws on euthanasia and assisted suicide. But that bill, like any unfinished government business, died on the order paper when Parliament prorogued in August. So as we'd expected, that legislation has been reintroduced very early in the new session of Parliament. The legislation itself is unchanged from what we had seen before. And conveniently, because of the order in which the legislation was tabled, the bill also has the same number, which is Bill C7.
Okay, and what are the proposed changes that are currently on the table?
Well, the most significant change is that this bill removes the requirement that a person's natural death be reasonably foreseeable to be eligible for M.A.I.D. So this would mean that a person with a disability or a chronic illness whose condition may not be terminal or who may, have decades to live could be eligible to have their life ended. This could mean that ending life will become a more common approach to illness or disability, rather than doing the work we need to do to ensure we have sufficient resources for medical treatment, support, and recovery. The bill also removes several other key safeguards that protect vulnerable people. So one of those is the mandatory 10-day reflection period between the time a request is made and the medically hastened death is provided. This means a person's life could be ended on the same day the request is made. So that safeguard of a period of careful consideration is at risk here. The bill would also no longer require that there be two independent witnesses to a request for M.A.I.D. There would only need to be one, and that person could be a caregiver. And it also allows for a person's life to be ended when they're not able to consent under certain circumstances. So currently, a really critical safeguard is that you have to be able to consent at the time M.A.I.D is provided. And I'd also note that while the bill says patients must be given information about services that could help alleviate their suffering, so about palliative care, about mental health, or social supports, there's not actually any responsibility to provide access to those services. So, this doesn't truly give patients a choice. And, all of these changes are really concerning.
M.A.I.D was, or medical assistance in dying, was made legal in Canada in 2016. But there was a case in Quebec that challenged the law on the books, leading to these amendments. Tell me why that case was so pivotal in what we're seeing now.
So challenges to the law were being filed or prepared almost as soon as the legislation had passed. The Quebec challenge was initiated by two individuals with disabilities whose deaths were not considered reasonably foreseeable. And so they were not eligible under the current laws. And they argued that medically hastened death shouldn't be limited to people who are dying. The lower court judge agreed with them and ruled that it was unconstitutional to limit M.A.I.D to a person whose death was reasonably foreseeable. She also rejected the argument in defense of the end-of-life requirement that one of the objectives of the law was in fact to affirm the inherent and equal value of every person's life. So what happened, despite requests from organizations like the EFC and from the disability community and from a number of medical professionals, unfortunately, the government didn't appeal that decision. Instead, they asked the court for an extension. So essentially a delay in the ruling taking effect in the province of Quebec to give them time to amend the legislation in response. So Bill C7 is their response. And the government hopes to pass this legislation by December 18th, which is when that extension will expire. So we're really concerned that as the government tries to meet this deadline, these life and death changes are going to be rushed through Parliament without the time and study they should have. So already today, the bill has had second reading. and it's had a couple hours of debate. So things are moving very, very quickly.
Yeah, very quickly. You're concerned, the EFC is concerned. Why should Canadians be concerned, and why?
Yeah, absolutely. I think that all Canadians should be very concerned about these watershed changes, not just Canadians of faith. When the laws were passed, I think Canadians understood that this was to assist people who were nearing death. We didn't agree with that view, and we continue to believe very strongly that the appropriate response to suffering is to ensure access to high quality palliative care. But this, nonetheless, I think was the general understanding of the public and I think of most of the government. To now say that M.A.I.D will be available to people who aren't dying is a watershed change in law, in medicine, and I think just in our culture. And it's a change that is going to most immediately and directly impact Canadians with disabilities. Disability groups are very, very concerned about these changes, which will in effect make people with disabilities eligible to have their lives ended solely because of their disability. The community argues that this change to the law would violate their rights to equality and inclusion under both Canadian and international law. I've learned a lot from the disability community over these last months and really tried to listen. And it is an unfortunate reality that people with disabilities already have difficulty getting the medical care and social supports they need. This inequity has only been heightened during the current pandemic, as people with disabilities have seen how critical care triage protocols often exclude them from critical care if resources are strained. This change to the law will put their lives at even more risk. They will feel even greater pressure to end their lives. And, I don't think it's just hyperbole to say that it sends the message that a life with chronic illness or disability is not worth living. We have to reject that notion unequivocally. One of the disability advocates said to us that our lives are on the line. And, I think the other thing we have to keep in mind is that these particular changes won't likely be the end of the conversation. The government is also poised to undertake a 5-year review of the current laws, which will involve looking at whether access to M.A.I.D should be expanded to mature minors and to individuals for whom mental health is the only underlying medical condition. So, I think these are things that all Canadians should be very, very concerned about.
You mentioned, Julia, that you feel like the process has gone so quickly. There have been a number of roundtable conversations, a survey filled out by 300,000 Canadians. Does the EFC feel like Canadians have been heard and listened to during those opportunities to voice their concerns?
So the roundtable conversations are a bit of a mystery to us. We are in regular communication with a wide range of organizations across the country that would be considered stakeholders in this conversation, particularly national organizations representing the disability community. And to our knowledge, none of these were included in these roundtable conversations. I could be wrong, but I have not heard of any that we've worked with that were part of this. So, and in terms of the online consultation, yes, 300,000 Canadians is a substantial response. But I'm not sure if you looked at the survey, but the survey was premised on the idea that M.A.I.D was no longer limited to people who were near death. So that was the assumption. And then all of the questions followed. So it never asked whether Canadians thought that that change was okay. It simply asked for feedback on what a number of safeguards might be, as though that requirement was already gone. So, it wasn't really truly designed to listen to Canadians on that critical question, I don't think. What does seem certain is that the voices of the disability community have not been and are not being heard, and that really has to change.
Okay, and last question. What do you think is missing from the conversation about medical assistance in dying that Canadians should consider when thinking about hastening their death?
So one of the things, as I just said, I don't think that the voices of national disability groups are being heard, not by the government, not reflected in the media. and so probably not heard and understood by many Canadians. This is really troubling. We have been trying to really listen to those who will be most impacted. And at a forum in Ottawa last winter held by a number of these national organizations, one of the leaders of these groups challenged us, and he said that there are so many things that we should be seeking to make easier for people living with physical or intellectual disabilities. Things like living in and being part of their communities, having access to work and to safe, secure, and affordable housing, access to the same level of healthcare as anyone else. But making it easier to use M.A.I.D to end their lives is not one of those things. I think we need to think about that. The other thing I would say is that we have not yet, as a country, addressed the need for widely accessible, high quality palliative care for all Canadians. Less than 30% of Canadians have access to palliative care. And it is unconscionable that we would make it easier to access hastened death in Canada than it is to receive palliative care, or than it is for individuals living with disability to access the medical and social supports that they need to enjoy living on an equal basis with other Canadians. In Canada, it should not be easier to have help in ending your life than it is to obtain the support and care you need to live.
All right. Julia Beazley, Director of Public Policy for the Evangelical Fellowship of Canada. Thank you so much for joining us today.
Thank you. My pleasure.